Riwruoge mathoth pod imedo jiwo mondo tudre kedo kod landruok mar midhusi mar COVID-19. Cordinator mar National Council for Population and Development ebade mar Siaya kod Kisumu counties, Migosi Benard Kigen, owacho ni sani en manyo yore mag duoko piny landruok mar midhusi mar COVID-19 e gwenge mag Kisumu. Kigen owacho ni gitemo yore duto mag keto okenge motegno machal gi moket Kisumu e nywando rowere kaachiel gi puonjogi kaka ageng'o tuono mar COVID-19.
This program has been launched in collaboration with other partners, and especially I'm happy because also the government was represented. That is the County Department of Health and also at national level, like the National Council for Population and Development. So we are happy that this program has been launched in Kisumu because it is very key given the fact that Kisumu County is one of the zonal areas where COVID has really skyrocketed. And it is a high time that various sectors or stakeholders, they come together so as to enhance or to harness on how we are going to reduce the issue of COVID-19 spread in Kisumu County. Just as I mentioned, the National Council is under the national government, and we have got that 11 regional offices in the country that covers all the counties of Kenya, that is the 47 counties. And this program is also being launched in other counties in collaboration with other stakeholders because we realize that COVID is affecting, it is a pandemic. It has gone throughout the whole world, it has gone throughout all the sub-counties. So this program is also being handled in other counties, that is the 47 counties. Right now, since COVID-19 started, through the national county government, that is the Ministry of Health, there's been some allocation which has been allocated to eradicating or to fighting against COVID-19. That is at national level, and also through the budget that is for the sub-counties. Even though there were some delays in some funds being distributed to the counties, but currently at least there is some amount of money that has been given so as to assist the counties in terms of carrying out any preventive